Good morning. Here we are in your knee, looking up at your kneecap. You got a big band of scar here. See that big band there? We're going to take that out. Look up at your kneecap. You've got a little bit of fraying up there, but not much. That looks pretty good. But we look down at your trochlea. Look at that. Boy, that's beat up. See that? So quite a bit of damage there. So and the yellow in the base of the defects there is arthritic. We've got to see if that central strip is worth saving or we should take it. Over there, wow, you are beat up. Over there, some bare bone stuff too. We are going to also harvest, well, we'll see. This is a pretty broad area, but we'll feel that. But I can't tell if that's healed in cartilage or if that's pretty much exposed bone. I think it's pretty much exposed bone with just a teeny bit of stuff there. But this is pretty loose, pretty junky, so we'll mess with that. Your graft felt great when you were asleep. Looks great too. There it is right there, going back there to the back. Little loose piece there next to it. So that looks really nice. As we extend your knee, a little bit of scar down there at the bottom, but nothing to write home about. Let's come over here. Loose piece of crud. Blow that out. So there's your meniscus on the inside. A little bit of a fissure there starting. Another loose piece back there. A little wear there. You're just banging yourself up. We'll probe back there and feel that in a little bit. We'll go by your ACL again. Come out here to the outside. Same thing. You're just making a mess of your knee. Crud all over. Look at that. I mean, it's not horrible, but it's not none, that's for sure. Meniscus out to the front. We'll feel that meniscus back there. It looks like you got a little tear there. All right, well, let's make a portal here and get going. Definitely going to drill the holes that we talked about underneath your kneecap. So here's my needle coming in. That should be okay as long as we go down. Dilating probe coming in next. Maybe. There we go. So that's about the size of a ballpoint pen. Give you an idea of how magnified that is. So your ACL exam was good. Drop the bed some, please. No, that's okay for now. Just trying to flush all those little loose things out there. So meniscus underneath is pretty good. Top's got a little scuff in it. There's a loose piece. Try and blow that out yet again. Lots of little wispies flying around here. Alright, so that's actually pretty good. That little piece that I thought was a little tear there was not. All this is just wear and tear. Back by your ACL. Let's just see if this little bit of wispy scar here. That's just a little scar off the front. I'll take a straight predator, please. That's not your graft. Oops, sorry. It's not your graft. It's just in front of it. So what I'm going to do is kind of go to over here and cut it off. this little wispy thing a scar too. And then I'm going to take the shaver and go in front here and kind of just munch that little place. Okay, go ahead. All right, off. Go. Off. That's about all I want to do. A little bit of scar over there, on. All right, off. All right. Yeah, that's not going to rub anymore. All right, I'll take the probe again, please. So, little tear of your meniscus there. See that little, that's what's rubbing actually. Look at that. See how that's right in line with this? So that's rubbing there a little bit. So I'll take a straight predator. It's not a huge tear. I'm sorry, up predator. Medial. So we're just going to trim out that little spot there. Teeny little flap. Pulse the suction for me. And I'll take a straight after all. Now we'll pass the shaver real quick and then be done with that. That was a pretty little tear, not none, and it was doing a little damage, so it's good to get that out. On, please. All right, off. Okay, that looks better. All right. Let's come up here now, really figure out what's going on. So you have the dark side of ACL reconstructions. Graft is fine, but all this other stuff is not great. All right, on please. So there's no reason to save that stuff that's loose there. So let's first eat a little fat. Get a little better view here. And then at the end, we're going to eat that scar. Probably could do it now. That's that scar band I showed you. That actually probably did some of this damage here. Some of that damage over there on the edge was from this scar rubbing. All right, off for a second. All right. On again. Right off. Let's look down at this now. Sorry for the blood. Probe, please. Pretty much full thickness over there. Eventually we'll feel this.